medicine today. I would like to congratulate or thank each and everyone for being with us in each and every of our endeavor. Undoubtedly, without your support, I would not have gone this far. Today is a totally different day. You might not have had experienced in your entire career as well. That much we are pretty sure. The incidents looks very simple or very routine. The biggest success, the biggest interesting area of today's press meet is outcome, for which one of our senior most cardiothoracic surgeon will detail about what is this case, how it is unique, and what we have exactly delivered. So I'll quickly move on to Dr. Govini Balasubramaniam. He is our senior most cardiothoracic surgeon. Right to me, Dr. Kalyan, who is also anesthetist, who is also part of this entire marathon surgery. Ultimately,
fell over his chest without any external injuries. It has compressed both anterior and the posterior part of the chest, thereby causing the heart rupture. Any heart rupture in this world, the mortality is 90%. And by the time they reach hospital, they will die. This is what it is. Luckily, he has survived. The reason being, there is a one layer which called the pericardium, which covers the heart. In that, almost 2 liters of the blood which is collected within that. Heart is ruptured, almost 3 centimeters part of the heart is ruptured. What of the blood which is coming from the lung to the heart, which has been flowing out of it. So, it is stabilized and has been shifted here for the further management. So, when he came here, we did the CT scan chest and we did the echocardiogram. We found there is a large collection around the heart. That time we didn't realize that it is going to be a rupture. So ultimately, because he had a very low BP and the heart rate was very slow, so we have to take him to the theatre immediately. When he entered into the emergency room, from there directly we are shifted into the operation theatre. That kind of emergency he was in. Even a single minute is important for this kind of patients. So we took him to the operation theatre. We opened his chest. Almost 2 liters of the blood which was lying within the pericardial cavity, which has been sucked into the one of the machine called cell saver. This cell saver is like a recycling machine for the blood. Whatever the blood is coming out, see, if it goes, if it come in contact with the external nerve, you can't use it. But where this machine does, it recycles the blood, whatever the blood is there. By the time we get the blood for the transfusion, it will be too late, because we have to transfuse immediately, because whatever the amount of blood which we lost, we have to transfuse immediately. So this recycle machine will do it. So we went on the bypass, that is into the heart-lung machine. We have to arrest his heart. Posteriorly, there was a tear we saw it. Even with our fingers, we are not able to control the bleeding. So almost 3 centimeters, that is the joining between the pulmonary veins and the left atrium. That is the heart and lung where it bleeds. So that tear has been repaired, and ultimately he was being saved out of it. The thing which we are want to highlight is a very kind of it's a teamwork. What I'm trying to say is a teamwork. So, felt any?
How many hours later?
So it took almost 2 hours for us to complete the surgery.
Next stage, how long will you take the rest?
What?
Next stage, how long will you take rest?
rest.
Now, what was the thing?
Bed test. How many days?
It's 3 to 4 weeks.
You said you was taken to the nursing home initially for first aid. From there, how did they realize there was some internal injury?
No, they had not realized any internal injuries.
Why was he brought to the
His pressure was too low. So what is happening is the blood around the heart, which is compressing the heart function. So thereby there is no flow into the heart as well. And whatever the blood was which is lying around it. So the pressure automatically will go down. And when he came here, I saw him in the emergency room. His neck veins were very swollen. It was like